whereas it is provided under Section 63(1)(a) of the Public Finance Management Act that the Minister of Finance may, by affirmative resolution of Parliament, borrow from a bank or other financial institution for the capital or current expenditure of government. And whereas it is further provided under Section 64 of the Act that money borrowed by the government must be paid into and form part of the consolidated fund. And whereas the Minister of Finance considers it necessary to borrow US $9.867 million from the ordinary capital reserves of the Caribbean Development Bank, allocated from the European Investment Bank's second action line of credit component resources, the loan for the implementation of the Building Public Health Resilience Coronavirus Disease 2019 Response Project. And whereas the loan is repayable in 76 equal or approximately equal installments, commencing 3 years after the date of the loan agreement, and whereas interest at the variable rate of 4% per annum is payable quarterly on the amount of the principal disbursed and outstanding from time to time, and whereas a commitment fee at a rate of 1% per annum is payable quarterly on the amount undisbursed from time to time, commencing from the 16th day after the date of the loan agreement, be it resolved that Parliament authorizes the Minister of Finance to borrow US $9.867 million from the ordinary capital resources of the Caribbean Development Bank, allocated from the European Investment Bank's second climate action line of credit component resources, the loan for the implementation of the Building Public Health Resilience Coronavirus Disease 2019 Response Project. Be it further resolved that the loan is repayable in 76 equal or approximately equal and consecutive quarterly installments commencing 3 years after the date of the loan agreement, interest at a variable rate of 4%. Interest at a variable rate of 4.06% per annum is payable quarterly on the amount of the principal disbursed and outstanding from time to time. A commitment fee at a rate of 1% per annum is payable quarterly on the amount undisbursed from the time commencing from the 16th day after the date of loan agreement. Mr. Speaker, as we are well aware, the coronavirus or COVID has not escaped us, continues. We continue to have issues, albeit not at the scale that we had before, Mr. Speaker. So, Mr. Speaker, this loan basically is, we are borrowing $9.8 million US, Mr. Speaker, basically to respond to this crisis, Mr. Speaker. Responding to this crisis means that we have to ensure that, first of all, we control it. That means avoiding further infections, and secondly, building our resilience so that this pandemic and any other pandemics, when they come, and it's a matter of when, Mr. Speaker, according to what the medical experts say, is according to when they come, we are prepared for it, and hopefully the death and destruction of COVID, Mr. Speaker, may not follow with any other infections, Mr. Speaker. Mr. Speaker, at February 28th, there have been 30,000 diagnosed cases of COVID and 409 deaths. As that, Mr. Speaker, 409 deaths and 409 deaths, and at the same time, Mr. Speaker, is only 1.4%. The fatality rate is 1.4%, Mr. Speaker. Mr. Speaker, the pandemic has impacted on the capacity of the health center to respond to the health threats and to continue giving an adequate level of health delivery services. So this law, Mr. Speaker, is going to strengthen the services available to the people of St. Lucia at three main levels: goods and services, infrastructure works, and project management. Mr. Speaker, I will deal briefly with these three components, and the Minister of Health will go into greater detail. Mr. Speaker, component number one, provision of goods and services. That is aimed at disrupting the chain of transmission of the coronavirus. It means, Mr. Speaker, that we'll provide resources to help to halt or to reverse the spread of COVID-19 and other emerging and re-emerging illnesses. The focus, Mr. Speaker, is on risk communication. The other part of that component, Mr. Speaker, is the strengthening risk communication and the vaccine campaigns. Mr. Speaker, you know, there is great hesitancy still among people to take the COVID-19 vaccination, Mr. Speaker. So this component is to help communicate with the public as to why they should why the vaccine, when it's available, that they should take it, Mr. Speaker. Because regardless of what we are hearing, it seems, according to a large part of the science, that the vaccines are the most appropriate way to halt the spread of infections, Mr. Speaker. Mr. Speaker, the other part of that component is strengthening service delivery for care of COVID-19, people who get COVID-19, Mr. Speaker. And that component will support the procurement of medical and non-medical equipment and supplies, the procurement of medication to improve the management care of patients, and to improve the health system capacity to support survivors and to expand the capacity for the continuity of essential care. Mr. Speaker, the other component is medical and non-medical equipment and general supplies. And this means, Mr. Speaker, that the loan will provide for medical equipment such as ventilators, X-ray machines, ultrasound machines, etc. And also, equipment will be procured for the Larry Seuss Wellness Center, Mr. Speaker. And part of that, as I'm on the Larry Seuss Wellness Center, I want to announce, Mr. Speaker, that part of this loan will be used to rebuild the burnt-out Larry Seuss Resource Center. Mr. Speaker, so we get equipment for the Larry Seuss Wellness Center, the Castries Urban Polyclinic, and again, I'm sure the Minister will expand on that. Part of this loan will be used to move the old health center to a modern urban wellness center, which will be located at the present Victoria Hospital location. The Minister, I'm sure, will expand further on that, Mr. Speaker. So, Mr. Speaker, the loan also will be used to purchase medicines, and will also be used to help in the purchase of medication for people who are suffering from non-communicable diseases like hypertension and diabetes, Mr. Speaker. This loan, Mr. Speaker, will also be used for infrastructure works. Infrastructure works that would strengthen the service delivery to the people of St. Lucia. And I spoke about the re-establishment of the Larry Seuss Wellness Center, the reconfiguration of wards at the Comfort Bay Home, the refurbishment of a burnt-out section and roof repairs for the Soufrière Hospital, the establishment of the Castries Urban Polyclinic, which, as I said, is the relocation and expansion of the Castries Urban Center, which will then be named the Castries Urban Polyclinic, and the construction of an annex at the Dennery Hospital. Then that annex will house urgent care, a doctor's office, a pharmacy, and some beds for observation. So, Mr. Speaker, this loan is going to have significant impact on health service delivery in St. Lucia. And not only in St. Lucia, not only in Castries, but in Dennery and Larissos and other parts of the country. Mr. Speaker, that is based on the government's emphasis on this year on national security and health. You will know that in our budget this year, Mr. Speaker, there will be a strong influence of national security and health, and also emphasis would be on the delivery of health care. In a further motion, as the day goes on, you will see we are going to be borrowing we are going to be making it easier for the OKEU to run their operations, Mr. Speaker, by paying an old debt and giving new money so that they can improve the situation of the OKEU. So, Mr. Speaker, in terms of health and national security, the Republic of St. Lucia can look forward to many things happening in these two sectors. Many things happen in these two sectors, Mr. Speaker, and we are sure that the benefits of the expenditure on health and national security will redound to the benefit of the people of St. Lucia as we continue for our mantra of putting the people of St. Lucia first. So this year, the coming fiscal year, the emphasis is going to be on health, as is clear. Last month or last session of Parliament, we borrowed money for health. This session, we continue to borrow money for health. And as we go, as we improve the health facilities, we will see that the government's emphasis on health care, we are putting our money where our mouth is to improve the quality of health for the people of St. Lucia, Mr. Speaker. So I urge members to support the motion as we look to put people first and have a healthier St. Lucia for the benefit of all. I thank you, Mr. Speaker. Mr. Speaker, I beg to lay the following. Whereas is provided under Section 65(1) of the Public Finance Management Act, Cap 15.0.1, the Act, that the Minister of Finance may, by an affirmative resolution of Parliament, grant a guarantee in accordance with an enactment. And whereas it is further provided under Section 69(2) of the Act, that a guarantee issued by the government or contingent liability created by the government in accordance with the regulations under the Act and in accordance with another enactment shall be charged on and paid out of the consolidated fund. And whereas it is provided under Section 41 of the Millennium Heights Medical Complex Act, Cap 11.07, that with the approval of Parliament signified by a resolution, the Minister of Finance may guarantee and any approved borrowing by the medical complex. And whereas it is further provided under Section 42 of the Millennium Heights Medical Complex Act, Cap 11.07, that a borrowing guaranteed shall, in default of payment by the medical complex, be charged on the consolidated fund. And whereas the Minister of Finance considers it necessary to guarantee a loan of credit from the First National Bank, St. Lucia Limited, the bank, to the Millennium Heights Medical Complex in the amount of EC 23.05 million, consisting of an overdraft limit of EC 6.5 million to assist with working capital requirements, a loan of 5 million to assist with operational expenses for the purchase of new equipment, etc., a loan of 11.4 million to satisfy a debt of the Ministry of Finance, a corporate credit card with a limit of 1.5 million to assist with monthly expenses, 150,000 to assist with monthly expenses. Thank you, Mr. Speaker. And whereas for the overdraft limit of 6.5 million, the terms of the overdraft is for 12 months, interest is payable at 6% per annum, subject to a change in line with the general level of interest rates in excess rate of 17%. And whereas for the loan of EC 5 million, the term of the loan is for 180 months, repayment of $46,985 monthly, with effect from 1 month after drawdown, with the last payment plus any outstanding principal and interest due 180 months after full drawdown. Interest is payable at a rate of 4% per annum, subject to a change in line with the general level of fluctuating rates. And whereas for the loan of 11.4 million, the term of the loan is 180 months. Repayment is for $84,324 monthly, with effect from 1 month after drawdown, with the last payment plus any outstanding principal and interest due 180 months after full drawdown. Interest is payable at a rate of 4% per annum. Some water, please. Subject to a change in line with the general level of fluctuating rates. And whereas for the corporate credit card, with a limit of 150,000, repayment is monthly. Interest is payable in accordance with Visa terms and conditions. Be it resolved that the Parliament authorizes the Minister of Finance to guarantee a line of credit from the First National Bank, St. Lucia Limited, the bank, to the Millennium Heights Medical Complex in the amount of 23.05 million, consisting of an overdraft limit of 6.5 million to assist with working capital requirements, a loan of 5 million to assist with operational expenses for the purchase of new equipment, a loan of 11.4 million to satisfy a debt of the Ministry of Finance, and a corporate credit card with a limit of $150,000 to assist with monthly expenses. For the overdraft limits, be it further resolved that for the overdraft limit of EC 6.5 million, the term of the overdraft is for 12 months. Interest is payable at 6% per annum, subject to a change in line with the general level of interest rates, excess rate of 17%. For the loan of 5 million, the term of the loan is for 180 months. Repayment is $36,985 monthly, with effect from 1 month after drawdown, the last payment plus any outstanding principal and interest due 180 months after full drawdown. Interest is payable at the rate of 4% per annum, subject to a change in line with the general level of fluctuating rates. For the loan of EC 11.4 million, the term of the loan is for 180 months. Repayment is for $84,324 monthly, with effect from 1 month after drawdown, with the last payment plus any outstanding principal and interest due 180 months after full drawdown. Interest is payable at a rate of 4%, subject to a change in line with the general level of fluctuating rates. For the corporate credit card, with a limit of EC $150,000, the repayment is monthly. Interest is payable in accordance with Visa terms and conditions. Mr. Speaker, again, as I said previously, this is another loan for the health sector in St. Lucia, Mr. Speaker. But, Mr. Speaker, I will deal with the one that is a little more complex, for want of a better word, which is the loan of 11.4 million for the payment of a loan due to an organization called Cayman City. Or better known as Narayana Hrudayalaya Limited. Mr. Speaker, that organization was contracted by the last government, Mr. Speaker, and the technocrats in the Ministry of Finance telling me that they were not privy to these negotiations, as it was the same with negotiations for other lease agreements where the staff of the ministry, technocrats, Mr. Speaker, were not involved. And Mr. Speaker, it's something that our government and have always, we've agreed, Mr. Speaker, that the policy directorate gives the policy and allow the technocrats to work out the nitty-gritty. Because in the final analysis, you can disagree and you can instruct. That is what the people of the country put you in government for, to determine the policy and to request from the technocrats to work according to that policy. Policy is not the domain of technocrats. Technocrats advise. Policy is the domain of the political directorate. We've made that clear. So what in our government, what we do is that we give the policy directions and follow the dictates of the technocrats as it comes to implementing that policy and making that policy workable. Mr. Speaker, but that didn't happen all the time. There are at least, and I'm sure there are more, at least two cases where the political directorate was directly involved in dealing with contracts, in dealing with contracts with suppliers, contracts with service providers, contracts with contractors, and the civil service, as we know it, had absolutely no say. And that is another one, Mr. Speaker. The terms of that contract, the technocrats tell me they know nothing about it. But the story is that Cayman City was contracted by the government to help, and I'm sure the minister will give the exact terms, to help with the transition of the medical services from Victoria to the OKU hospital. But fortunately, unfortunately, Mr. Speaker, that transition was done purely by St. Lucians. St. Lucians did it purely because when the United Workers' Party won the elections in 2016, they promptly dismissed the transition team that was set up by this government. The team was promptly dismissed, a team led by Dr. Stephen King. They were dismissed, summarily dismissed, for reasons best known to the then government. And these are facts. So that Cayman City a contract was given to them to help in that transition. Unfortunately, COVID came, and the same team that was dismissed, some members of that team were used to help in the transition from Victoria Hospital to the OKU, St. Lucians. Again, faith in the people of St. Lucians, Mr. Speaker. Not having faith in the ability of St. Lucians is the same situation we are facing with the CCJ. We have no faith in our own. We suffer from so much self-hate that we don't believe in our own capability, we don't believe in our own ability to do things. So you find a transition team led by technocrats, you fire it. And you go into a contract with other people to do the same thing that the transition team could have done. So, Mr. Speaker, a contract was given to Cayman City, and the contract was for 2 years, and the contract amount was as follows. In the first year, $4.65 million US. In the second year, $4.65 million US. That payments were made to the Cayman City. I can't put it is Nayariana. I'm not trying. So NHL or NHL, Mr. Speaker. Payments have been made to NHL, Mr. Speaker. There have been payments 1, 2, 3, 4, 5, 6, 7, 8 payments, Mr. Speaker, made to them, and these payments were made between the 10th of July 2020 to December 2021. So it shows again we paid some of it. We paid, meeting the commitments of the last government. We paid some of it, Mr. Speaker. Mr. Speaker, I just want to tell you, are you aware that there were some contractors, because, at least one, because the last government believed that these contractors supported the St. Lucia Labour Party. You know these contractors were not paid? They were not paid, Mr. Speaker, and caused them to put them in financial peril because it was believed that these people supported the St. Lucia Labour Party. And now we have to pay interest, a further drain on the resources of the country. We have to pay interest to these contractors. But Mr. Speaker, even though, as I said, that contract was not incurred by us, even though the technocrats said that they knew nothing about it, we continued to pay, Mr. Speaker. But the point, we have reached a point, Mr. Speaker, where the contract has expired, a report has come in, which the minister will expound on, Mr. Speaker, and we have to pay the balance of the contract, which, Mr. Speaker, is approximately $4.173 million. $4,173,648.28, which is $11,339,385. And that is why we are borrowing the money today. We are allowing the Millennium, the OKU, to borrow the money, and the government is guaranteeing it, Mr. Speaker. Because the good name of St. Lucia was under stress. Because it was a foreign company, a large foreign company, and the good name of our country was under tremendous stress because it was being said that we were not meeting our commitments and we were not paying our bills. So this government, wanting to maintain the integrity of St. Lucia's good name, wanting to maintain the integrity of St. Lucia as a client that we can do business with, we've decided to allow the Millennium Health Facility to borrow the money, and the government is guaranteeing it. So if there's any default in payment, the government will meet it, Mr. Speaker. So it just shows you the responsible manner in which we approach government. In that we are saying that even though there is a debt which we really do not know very much about it, but we are going to pay it, Mr. Speaker, and hence the reason why we are borrowing, we are assisting the OKU Hospital to borrow the money to pay back that amount to Cayman City, Mr. Speaker, approximately $11.4 million. Mr. Speaker, the rest of the remainder of the facility will be used as I said when I was reading the resolution. $5 million will be used as a loan for capital development and operational capital development in the hospital and for equipment, etc. And here's how it's going to be used, Mr. Speaker. We're going to insulation of the chilled water system. That is $1.084 million. The project involves the replacement of the insulation around the chilled water pipes. It has been assessed and confirmed that the replacement of the chillers and the new modular chillers at the OKU Hospital is incomplete. Without the re-insulating of the chilled water pipes, the design of the exhaust system, and the installation of centralized system in order to control the heavy humidity, high temperatures, heavy water leaks due to condensation and poor ventilation at the complex. The condensation and mold growth has further deteriorated the insulation, which needs to be urgently replaced. The effect to the system over the past 3 years have led to serious issues for staff and patients. Disruption of services at the children's ward. It had to be closed for 3 months as the ward became inhabitable. Frequent mold and damage to many electrical and biomedical equipment. Recurring mold growth after an air quality assessment. This has led to costs of $15,000 per month for the past 3 months for deep cleaning in in that part of the hospital, and poor ventilation and air exchanges for the hospital, Mr. Speaker. Mr. Speaker, so it's necessary. We can't allow our people to be under these circumstances. It's necessary for us to borrow that money. And Mr. Speaker, there's been a mold. There's been an outbreak of mold in St. Lucia, Mr. Speaker. Mr. Speaker, but let me just tell you a little story that I was told to by somebody who knows better. Who knows, Mr. Speaker. Mr. Speaker, there's the new government talking about mold and health. The new financial complex. There is a serious issue of mold in that financial complex. A building that was built, a modern building, recently built. And we're inquiring, why is that mold in that building, Mr. Speaker? Mr. Speaker, you know, that story, it shows you how this country was run. It shows how this country was run, Mr. Speaker. Mr. Speaker, when the movement to that new building was taking place, the technocrats in the Ministry of Finance, they employed or they contracted a suitable and qualified moving company. A company with the necessary trucks, the necessary equipment, the necessary knowledge to move the desks and the equipment from the old buildings to the new buildings. In doing that, an assessment was made. And the company warned them that some of that furniture should not go into the new building, and they should have at least the papers and documents and the files should be cleaned and before it went, and they should be transported in proper covered vehicles, Mr. Speaker. But Mr. Speaker, for some strange reason, a minister of government, that shall remain unnamed, decided that the contract for the movement from these buildings to the new complex had to be done by somebody who was not trained, who was not qualified, who didn't have necessary moving equipment. That person, an instruction was given that that person must give him that contract. So the contract was given to that individual, Mr. Speaker. They transported the stuff in open trucks, and rain fell, and all the things got soaked, and they took it and they brought it into that confined atmosphere environment in the new complex over there. Soaked papers, desks, and they put it in there, Mr. Speaker. And the rest is history. The rest is history. Now, in the coming estimates next week, you see we have to spend $1 million on these buildings because the Eastern Caribbean Central Bank, who are renting the bottom floor, they have given notice that they are going to leave, that they are leaving because of the mold infestation. Staff in the ministry have to work at home, most of them. The Minister of Finance has an office there, he hasn't been in it. So the problem, Mr. Speaker, is because of one man who decided that he had to go against the dictates and the advice of the technocrats and do his own thing for first of all, for political retribution, because the company that was given the contract, that company was not politically correct to the minister. And secondly, he wanted to, as usual, victimize one to support the other. And when he gave it to the other person who was not qualified in that business, that caused the mayhem and the problems you have there today. And I'm sure the member social doesn't know about it. Because I don't think he would deal with that kind, because he knows how serious that situation is. So right now, the mole in that building, Mr. Speaker, the mold in that building, Mr. Speaker, is because of a poor practice. A practice of political retribution on one side and political victimization on the other side. And many situations in this country is due to the short-sightedness, Mr. Speaker, and the necessity for political retribution. So, Mr. Speaker, that is why we are where we are, and that's why we are where we are, Mr. Speaker. Speaker, $2 million of that $5 million will be used for the rehabilitation of the wards in the hospital. Many of the wards are the National Mental Wellness Center, the Turning Point Rehabilitation Center, and the complex are in dire need of repair and refurbishment. And Mr. Speaker, the National Wellness Center, it's very important that we are spending some money to improve the conditions there, Mr. Speaker. Because, Mr. Speaker, sometimes we forget about, when you talk about health, we don't speak about mental health. And it's very important that we deal with the mental health of the country, particularly after COVID, particularly after the stresses and the strains that are happening, Mr. Speaker. And talking about mental health, we've taken a decision that as soon as necessary, we are going to be working the member for Beaufort South. We're going to be seeing about some sort of counseling for the community of the areas that got affected by recent violence, and particularly the relatives of the people who got affected. We are going to be doing some counseling for this, Mr. Speaker, to see about their mental health and their mental well-being, Mr. Speaker. Mr. Speaker, there are 6 inpatient wards that are in a dilapidated state, and they have been in existence for more than 12 years at the Wellness Center without any major upkeep, Mr. Speaker. So as a result, most of the building and the furniture have been seriously destroyed by external factors, Mr. Speaker, and we need to repair it. We need to repair the wards, and we need to replace some of that furniture, Mr. Speaker. The other part, the $864,000 of that $5 million is going to be used for upgrade of the sewer water treatment plant, Mr. Speaker. Mr. Speaker, the wastewater treatment plant, it serves both the OKU Hospital and the National Mental Wellness Center and the Turning Point facility at the Millennium Heights Medical Complex. The plant has been malfunctioning since 2017. Since 2017, Mr. Speaker, the sewer treatment at the OKU Hospital, at that facility, has been malfunctioning. And you talk about priorities, Mr. Speaker, and you speak about a government of priorities. Since 2017. In spite of partial repair and upgrade that was conducted in 2020, the membrane and the pumps along with the associated parts continue to further deteriorate. The plant is now unable to process the waste water treatment, the sludge and wastewater, in a timely manner. The outcome of these defects leads to an overflow of the septic sludge into the environment, leaving a heavy foul stench on the Millennium Highway, and the depositing of septic water into the stream, thereby contaminating the water. Mr. Speaker, these are the conditions at the Millennium Hospital. Mr. Speaker, these are the conditions. Mr. Speaker, and we need to improve that, and you're using $864,000 from that $5 million loan to improve these conditions, Mr. Speaker. Mr. Speaker, $734,000 will be used to install a backup generator. That involves the commissioning of a new integrated 2,000 kV generator into the current electrical system, Mr. Speaker. Mr. Speaker, whilst we are doing that, we also, as a backup, we also have to look into putting solar power in the hospital. We have to look at that, Mr. Speaker, and I'm sure that will be worked upon very early in this year as we get the Electricity Supply Act, as we get the policy towards solar power, as we get it finalized this year, Mr. Speaker. Mr. Speaker, we're also going to use $203,000 of that money to upgrade the building maintenance system, the BMS. The building maintenance software controls the building automation and temperature control system by controlling and monitoring the following systems: air handling systems, central utility plants, including chillers, chilled water pumps and boiler rooms, water system and dialysis plants, fire system and electrical main distribution center. The existing system currently performs partial monitoring and very limited control. It requires a high level of operator intervention for system monitoring and equipment interaction. The assessment concluded that the existing BMS infrastructure, sensors, wires and support systems are damaged, worn out and out of calibration and require immediate upgrade. So we use some of that money to upgrade the system, Mr. Speaker. We're also going to use $144,000 for that money to repair and upgrade the fire alarm system. It was on commissioning of the OKU hospital, it was assessed that the fire alarm system was not fully functional and many of its components were faulty. Furthermore, the software program has since become obsolete and unable to connect with the fire alarm panel, thereby timing the functionality of the system, Mr. Speaker. Mr. Speaker, this deficiency does not provide live access or monitoring of the alarm system, and as such, notification signals are compromised. This places the entire hospital operations at risk in the event of a fire, Mr. Speaker. So, Mr. Speaker, the project summary is as follows: installation of a chilled water system, and I'll give you the exact figures, $1,084,670. Ward rehabilitation, $2,006,570. Upgrade of a sewer treatment plant, $864,000. Installation of a backup generator, $744,650. Upgrade to the building maintenance system, $203,310. Repair and upgrade to the fire alarm system, $144,000, coming to $5,047,200, Mr. Speaker. Mr. Speaker, that is how the $5 million will be used, Mr. Speaker. So, Mr. Speaker, we cannot allow a gift from the European Union, a gift that costs so many million, about $48 million, euros, to go to waste, Mr. Speaker. We cannot allow it. And the government and the minister will expand on the work that we are doing on the Millennium Heights Medical Complex. But while we are doing that, we want to ensure that the quality of patient care improves, that the patients, and there have been some notable improvements in that facet of care at the hospital, Mr. Speaker, but it's a work in progress. So improving these physical conditions at the hospital, we hope that the quality of patient care given by the people who work there will improve, Mr. Speaker. And whilst I'm on my feet, I want to thank the people who work at the OKU. They've been having some challenges. I want to compliment the board for the work they are doing, but I'll say something to you, Mr. Speaker. Unity of purpose will help us, Mr. Speaker. Unity of purpose. If we have the same aims and the same objectives, and not a matter of one-man-upship, or not a matter of looking at, we have to look at the health workers, that they give a labor of love. And if we understand that, and if you understand that, the country will benefit, Mr. Speaker. The other part of the credit is a $6.5 million for operated overdraft. Overdraft, which speaks for itself, fluctuates. The member social knows very well about it. Fluctuates, so it'll give the the OKU and the complex some more flexibility in that paying the debts, etc. Give them some more flexibility, and then the $150,000 of credit credit card, Mr. Speaker, again to give them more flexibility, right, to buy some urgent purchases on credit card. So all in all, Mr. Speaker, is another investment in the health of the nation. Another major investment, 23.5 million. And last week again, we borrowed some money. We allowed St. Jude Hospital to get some money to improve their quality of care at St. Jude, Mr. Speaker. But Mr. Speaker, this is just a drop in the ocean as to what is needed for the complex, Mr. Speaker. It's estimated that we may need some $52 million to get it functioning to a real top-class global center, about $52 million. We've got $23 million now, albeit $11 million does not belong to us. $11 million is to pay a debt, but that's a start. And I want to thank the staff of the hospital, the staff in the Ministry of Health, Mr. Speaker, for the work they're doing at the Millennium Heights complex, particularly the OKU, and to ask that the public to be patient and respectful. Patient and respectful, because it's not an easy job, not an easy task, and I ask the public to be patient. It's a work in progress. We are gradually improving the conditions at the hospital, and as you see, the government is putting where its money, where its mouth is, by borrowing for the people of St. Lucia, which is the theme and the motto of our government. I thank you, Mr. Speaker.